Our top story tonight, 2 more people have died due to suspected drug overdoses this past weekend. As Here and Now's Malone Mullen reports, advocates are calling on government to ramp up their response to prevent more deaths.
Police say toxic drugs are here to stay. And according to harm reduction advocates, they're killing more people than ever. 2 more died over the weekend from suspected overdoses, likely related to fentanyl, an opioid that's 50 times stronger than heroin. These days, it's being sold to unsuspecting partiers, largely in cocaine.
We have learned that there is presence of synthetic opioids, such as fentanyl, within those substances.
Police alerted the public last week to a string of deadly overdoses. There's now at least 11 in the last month. Those deaths aren't letting up, and this advocate says education is critical.
Even though the government introduced naloxone a few years ago when the opioid crisis was recognized in the rest of the country, they failed to provide information about what harm reduction is. The lack of education kills people. Simple as that.
Harm reduction focuses on making sure people can use drugs safely, instead of trying to prevent them from using drugs at all. It includes clean needles, supervision, peer support, and in some cases, a safe supply of street drugs. But this province is now focusing its efforts on naloxone, a drug that reverses an opioid overdose. The health minister said today officials handed out 400 naloxone kits over the weekend and have ordered 800 more.
We can't eliminate the product that's available on the street. You know, that simply won't happen, but we can make the kits available to anybody and everybody who need them, and they will be available to anybody and everybody who needs them.
It's a far cry from abstinence messaging. Even police are on board.
The RNC taking a harm reduction approach is the approach that is going to save lives. And that is our focus, is preserving life.
But for Tree Walsh, naloxone kits won't help if political leaders don't act now to make sure people understand why they're using them.
What's happening in Vancouver is coming here. We can do our best to reduce the harm if we implement the right policies. Mr. Osborne, instruct your harm reduction section to get it together and produce a provincial education platform, not only for the workers, but a public one as well. Because if it's not introduced sooner, more people will die.
In a country where 20 people die of overdoses every day, for advocates like Walsh, how fast our institutions can change in response to this new influx of fentanyl is very much a matter of life and death. Malone Mullen, CBC News, St. John's.